Oxygen delivery and consumption. Global oxygen delivery, DO2. It is the amount of oxygen delivered to the tissues per minute. The unit is ml per minute. DO2 is calculated by oxygen flux equation. DO2 is equal to arterial oxygen content into cardiac output into 10, where 10 is the conversion factor for the units. Arterial oxygen content is a product of hemoglobin and arterial oxygen saturation. So global oxygen delivery can be optimized by improving each of these factors. Hemoglobin can be increased by using blood transfusion, iron supplement, or treatment of underlying pathology of anemia. Arterial oxygen saturation can be improved by increasing FiO2, optimizing PQ matching, preventing alveolar collapse by using PEEP. Stroke volume can be improved by increasing preload, for example using IV fluids, or increasing myocardial contractility. Heart rate can be improved by using beta stimulants or antimuscarinic agents. So DO2 is equal to arterial oxygen content into cardiac output into 10. The value of arterial oxygen content is 20 ml per deciliter. Value of cardiac output is 5 liters per minute. 10 is the conversion factor. The value of DO2 comes as 1000 ml per minute. Global oxygen consumption, VO2. It is the volume of oxygen consumed by the body per minute. The unit is ml per minute. VO2 is given by arterial oxygen content minus venous oxygen content into cardiac output into 10. Arterial oxygen content is given as 20 ml per deciliter. Venous oxygen content is given as 15 ml per deciliter. Cardiac output is 5 liters per minute. 10 is the conversion factor for different units. The value of VO2 comes as 250 ml per minute. Factors increasing VO2 are surgery, inflammation, sepsis, pyrexia, pain, anxiety, postoperative shivering, physiotherapy, burns, trauma, seizures. Factors decreasing VO2 are sedatives, which reduce the cerebral metabolic rate, mechanical ventilation, preoperative fasting. In this diagram, we can see that oxygen delivery at rest is 1000 ml per minute and oxygen consumption at rest is 250 ml per minute. So there is big buffer of spare oxygen to use for the body in case of reduced oxygen supply or increased oxygen requirement, for example, exercise. Critical DO2. It is the minimum oxygen delivery that can meet the oxygen consumption demand. The value is 4 to 8 ml per kilogram of body weight per minute. Below critical DO2, the oxygen demand cannot match the oxygen supply. So oxygen consumption becomes supply dependent. Beyond critical DO2, oxygen consumption is supply independent. Below the critical DO2 point, the anaerobic metabolism starts to meet the energy demand. It is called as anaerobic threshold. Anaerobic metabolism leads to formation of lactic acid. Lactic acid is used as surrogate marker of hypoxia. Oxygen extraction ratio. It is the ratio of oxygen consumption to oxygen delivery. It is given as VO2 divided by DO2. Oxygen extraction ratio at rest is equal to 250 ml per minute divided by 1000 ml per minute. The value comes as 0.25. Oxygen extraction ratio will increase if VO2 increases, for example in sepsis, exercise, or DO2 decreases, for example hypovolemia. Different tissues have different oxygen extraction ratio. Heart and brain have high OER at rest. During exercise, heart is more dependent on increased perfusion to satisfy the demand than increasing oxygen extraction.